As most people know by now, there are three different types of MAT, which stands for medication-assisted treatment. There's methadone, which has been around since the 70s, Suboxone, that's been around since about 2002, and Naltrexone, that's been around since the 80s, but only really became helpful when it became available as either an implant around 2000 or as Vivitrol around 2007. And one of the questions that comes up a lot is which is the best MAT for a particular patient. Well, of course, each one has its strengths and its weaknesses. To go through the methadone has to be taken daily at a clinic. You do get some take-homes after you've behaved and stuff, but it's particularly good for people who need a lot of structure, maybe people whose life is really out of control and they really can't control their ability to stop using other street drugs, so they really benefit from going every single day and having to see a therapist on a regular basis and having to basically earn the trust of the facility. Suboxone is available through a doctor's office, and we're actually starting some Suboxone patients now in our office because it's a pretty good treatment for a lot of people who really are pretty stable but need to come and see the doctor on a regular basis. So typically people will get 1 week scripts at a time, and then over a period of time they'll maybe graduate up to every 2 weeks or once a month. And of course it's useful to help with cravings and to help with relapse. And then Naltrexone, which we've been using since about 1998 as an implant, but also use Vivitrol, is very helpful for people who want to be completely abstinent and not on any kind of addictive or mood-altering drug. The truth is Naltrexone, Vivitrol, and implants is very powerful, and some studies lately have shown that it's just as effective as Suboxone, but it's particularly good for people who are stable and are really committed to their recovery, people who are adamant that they want to stay off of alcohol and pot and other drugs, go to support groups like AA or Smart Recovery, come and see their therapist and come and see their doctor on a regular basis. It's often best for people who have a job or in school, who are in a stable kind of relationship and have a lot going for them because they have that sort of support already. If people do relapse on Naltrexone, then they can be at risk of having an overdose. So we want to have it available for people who are serious about their recovery and are working hard at it. One of the advantages of Suboxone or methadone is because the receptors are already full up with a addictive drug, it's somewhat protective if people do mess up and use other drugs or even use opioids, because a lot of the effects of the opioids are blocked, and so they often don't overdose, and so they're somewhat protected that way. But at the end of the day, most people don't want to be an addictive drug, they want to be completely clean. So what we're finding is over time that the field is moving now to try to get more sophisticated at picking, who's the best in which particular MAT, and oftentimes it's a process. So if people start off on methadone or Suboxone, get their lives more stable, get things going with their emotional state is better, their behaviors are consistent, they're staying off of other drugs, then they become ready for Naltrexone. And they have a much better success rate, and they feel much better once they get off of those other drugs and onto Naltrexone when they're ready for it.